Good evening, all the aspirants present here. The debriefing session will be taken by Dr. Asif Iqbal, sir. Sir, you can share your site.
Yeah. Good evening, all. Today, I will talk about my respiratory cases. So, my
Aspirants, this is going to be a very interactive session. Please do unmute your mic, or else you can also drop your answer in the chat box.
okay. So, I think Maria has given this exam, so he knows most of the answer, and still we continue. Let's see. So the case was 62-year-old man presented with a fever, productive cough and breathlessness for 4 days and presented in the emergency with blood pressure 82/86 and heart rate 122, respiratory rate 34, SpO2 is 88 and 15-liter oxygen, temperature 39.5 degrees Celsius, CXR right, lower lobe consolidation and lactate is 4.6. You may get the small pinpoint scenario or big scenario, but remember you have to either you can note down the values, important values on your piece of paper, or you have to remember that because the next question is depend on this variant. So, and when you are giving answer, is not a generalized answer. Obviously, there are some point will be considered as a generalized, but you have to give more specific about the patient which you are treating. Okay. So all are the scenario will given by the ESICM, that is a real patient data. So always try to remember the figure and the fact, and also the abnormal values which help to give you the proper answer. So here the case is 62 years with the hypotensive and the tachycardic, tachypnea is there, temperature is high, lactate is high, not giving information about mental status, but in real scenario, obviously they will give you the mental status. This is the chest X-ray. So right lower and lower jaw pneumonia. So first question is, how do you assess the severity? So regarding the assessment of the severity, you have to utter the name of certain severity scoring system, like your CROB 62, which is very common in UK, and also ATS guideline for there are major criteria and minor criteria, and also there is a CPI score. But first you utter this CROB 65 because scenario will give related to that. You can and scoring that how much is the CROB score, and CROB score is help you not only the prognosticate, also it guide you where you will admit the patient, whether in the ward or in the ICU. And I hope everybody knows the CROP 65 and initial manage. Then the question will come the initial management priority. Whatever the scenario, they will give you the this initial management priority. And when they will utter the initial management priority, they prefer you give answer like A, B, C, D, E, F order: airway, breathing, circulation, disability, and exposure. For trauma, disability and exposure is important. For the respiratory case, airway, breathing, circulation is very important. So initial management priority will be take care of the airway, take care of the breathing and the circulation, because your patient is tachypneic, tachycardic, hypoxia is there, and also the hypotension is there. So then the question is, what are the indication for mechanical ventilation and this patient? So you can argue that I'm not going to intubation immediately. First, I will try with the oxygen supplement with NIV or HFNC, whatever your preferable things, and you have to reason for that, and you have to know how will you monitor these things. So if you give the NIV, then you have to tell that since I'm not knowing the mental status of the patient, if the patient is not disoriented, not comatose, I can try with NIV, or I can try with the HFNC, and I will continuously monitor the patient vitals. If NIV failure, like after half an hour, I will do AVG, and if the desaturation worsen and consciousness worsen, or the AVG is altered, then I will go for the mechanical ventilation. If you are prefer the HFNC, again you will say that I will prefer HFNC, but I will monitor every 2 hourly, and every continuously monitor every after 2 hours or 1 hours. I will do AVG. I will see the condition, I mean, of the blood gases. If the oxygenation is not improved, or the redox score is more than 3, then I will consider that HFNC failure. I'll go for the mechanical ventilation. And if the patient giving the saturation giving much less, the big pneumonia, you can directly go for intubation. You can say that patient is altered sensorium, patient is in a shock, and comatose. So I will go for the mechanical ventilation. They will, in this particular question, they will judge your knowledge and your practical knowledge about handling of the patient. Nowadays, for the last year also, they ask about the corticosteroid status in your ICU. So in pneumonia, so severe pneumonia, the few of you given a good answer on the corticosteroid state, that in a severe pneumonia it is indicated, or in patient when patient is shock and pneumonia sepsis, then steroid has a good role, but it is not indicated when it is a case of influenza. You will not give. Biomarker for prognosis.